So we know that COVID-19 can be categorized as mild, severe, and critical. But how do we know whether or not we are well enough to stay home and self-isolate, sick enough to call an ambulance or go to hospital, or somewhere in between? We don't require an ambulance or hospital, but we do require some medical intervention. In these confusing times, it's important that we make ourselves familiar with the red flags of COVID-19. Those red flags telling us it's time to act. So, what are the red flags of COVID-19? Well, shortness of breath, so being unable to complete a sentence while at rest, significant worsening of your condition, persistent pain or pressure in the chest, a blue tinge to the lips or face, or you're pale, unusually cold and clammy. You've got an audible wheeze and you need to lean forward and support yourself to breathe, or that tripod position. Confusion or increased confusion from the patient's normal state. You can also ask yourself a range of questions, or ask the patient a range of questions to identify the red flags. These include questions such as, are you so breathless that you are unable to speak more than a few words? Are you breathing harder or faster than usual when doing nothing at all? Are you so ill that you've stopped doing all of your usual daily activities? Has your condition changed from its everyday normal? And then taking a look at the bottom at those pictures, a high temperature, coughing, sore throat, and shortness of breath. Keep an eye out for those signs and symptoms. Now, as of April 1st, 2020, research is still being conducted to determine the best treatment therapies for COVID-19. While extensive research has been conducted over the past 2 decades on coronaviruses such as SARS and MERS, no definitive treatment has yet been discovered for either of them or for COVID-19, and prevention still remains the best cure or treatment. Our first line of defense really is prevention. So that means social distancing, good hand hygiene, respiratory hygiene, avoiding touching your face, especially while you're out in the community, refraining from smoking and other activities that weaken the lungs, maintaining at least 1.5 meter distance between yourself and others while surrounded by those outside of your household. So really, remember, social distancing, wash your hands. It's really vital at this point in time. Now let's talk a little bit about social distancing. In the times of the Spanish flu during 1918, strict measures of social distancing was adopted in order to fight the spread of the contagion. When the cure and treatment puzzle remains unsolved, as it is at the moment, for a new emerging pathogen, adopting the same method as we did 102 years ago may be the best course of action, or the best possible option for us right now. So what is meant by social distancing? I think we've all heard this before, haven't we? Stay home unless essential to go out. Avoid social gatherings or inviting people to your home. Avoid physical greetings and maintain 1.5 meter distance from others in public. But be aware of what you touch and build a bubble of protection around you, as shown in the next video. Social distancing is a tool that is readily available to the public while we wait for scientists and healthcare professionals to develop a vaccine or viable treatment for COVID-19. If put into practice, this tool will essentially save not only the lives of those with COVID-19, but also those suffering from other medical emergencies such as car crashes, heart attacks, and a severe case of the flu. Essentially, what we need to do is flatten the curve so that our healthcare can actually keep up with the number of cases that they see every day. So let's take a quick look at a video from the New Zealand government on social distancing and creating your bubble of safety.
This is a COVID-19 message from the Ministry of Health. Right now, people in at-risk groups need to do everything they can to stay away from anyone with the COVID-19 virus. This means being careful and making a plan. Don't be scared, be prepared. An important part of your plan is to build your bubble. Your bubble is like a protective shield to keep you safe from contact with COVID-19. It's important to talk to everyone in your household, including children and family, and anyone else who provides you with essential supports, so that they can also be part of your bubble. Everyone inside your bubble needs to know what to do at home and when going out in public, so they keep your bubble safe. This means you are all practicing physical distancing from others outside your bubble. For example, if one member of your bubble hugs someone outside of your bubble is then open, and there is more chance of catching the virus. For more information about how to keep yourself and your whānau safe, visit health.govt.nz.
We'll show you is going to give you a quick look at why washing your hands is so effective at helping us control the spread of COVID-19, and why it's so important that we practice good hand hygiene while we're trying to prevent COVID-19 from infecting us and those we care.
Know that the best way to prevent the spread of coronavirus is to wash your hands.
Wash your hands.
Wash your hands!
But why? It's because soap, regular soap, fancy honeysuckle soap, artisan peppermint soap, just any soap, absolutely annihilates viruses like the coronavirus. Here's how. This is what a virus like coronavirus looks like. It's a bit of material surrounded by a coating of proteins and fat. Viruses easily stick to places like your hands, but when you rinse your hands with just water, it rushes right over the virus. That's because that layer of fat makes the virus behave kind of like a drop of oil. You can see it happening in this demonstration. Oils are just liquid fats. What happens when you pour oil into water? It floats. It doesn't mix. But add soap, and suddenly that fatty oil dissolves into the water. That's because inside, soap has two-sided molecules. One end of the molecule is attracted to water, the other end to fat. So when the soap molecules come in contact with water and fat, these dual attractions literally pull the fat apart, surrounding the oil particles and dispersing them through the water. Let's go back to our coronavirus molecule with that layer of fat holding everything together. When it interacts with soap, bam, that fat gets pulled out by the soap. Soap literally pulls apart and demolishes these viruses. And then the water rinses the harmless leftover shards of virus down the drain. But, and you know where I'm going with this, it takes time for this effect to happen. 20 seconds to be specific. To show why, we ordered this lotion that mimics viruses and their fatty layers. It glows under a UV light. If you just rinse your hands under regular water, nothing comes off. If you wash with soap for just 5 seconds or 10 seconds, your hands are still covered. The virus is still there, able to get you and others sick. But 20 full seconds, now the soap is actually destroying the virus. Hand sanitizer works too because it's mostly alcohol, and alcohol works in a somewhat similar way to soap, breaking down that fatty layer. You need a high concentration of alcohol to make that work. The CDC recommends hand sanitizers with at least 60% alcohol. But even with 60% alcohol, the CDC recommends using soap if you can. If your hands are sweaty or dirty when you use the sanitizer, that can dilute it and diminish its effectiveness. As for soap, just any old soap works. You don't need soap marketed as antibacterial even. The FDA says skip it. There's no proof it's any more effective. Just be sure to wash your hands for 20 seconds. That's happy birthday twice.
Happy birthday, dear. I guess me.
Or the chorus to Lizzo's Truth Hurts.
Straight to my face.
Or Prince.
Raspberry beret.
Or Eminem.
Go, go. Only got
Or even Dolly.
Jolene, Jolene, Jolene.
Just as long as it's 20 seconds. And you're using the ultimate virus annihilator, soap.